Symptoms. Let's take a deeper dive into what we had just seen. We saw that Allie exhibited the first signs of psychosis, but what exactly do we mean by psychosis? The word is often used as an umbrella term to describe a number of experiences that may be associated with different mental health conditions, such as delirium, post-traumatic stress disorder, and major depression. In our course, we focus solely on the schizophrenia spectrum of psychosis because these disorders evolve over the transition from adolescence to adulthood and are progressive. Early identification and treatment can prevent development of severe symptoms, treatment resistance, and functional impairment. Here, the most common definition of psychosis would refer to a temporary loss of contact with reality. Simple enough, but what does that loss of contact look like? How does it manifest early on? The symptoms that make up this definition of psychosis are often known as positive symptoms, thusly named because they are seen to provide experiences beyond the range of typical human experience. One example is a delusion, which is defined as an unusual thought or belief, such as grandiosity and paranoia. Another example is a hallucination, which is an experience of external sensory activity in the absence of actual stimulation. Auditory and visual hallucinations are the most common, but they can essentially occur in any of the 5 senses. Additionally, it is not uncommon for an individual to demonstrate disorganized communication, such as going off on tangents when speaking, or bizarre behavior, for example, wearing lots of layers of clothing on a hot day. However, as we'll see later in the course, we must be mindful of carefully assessing this notion of bizarre behavior, especially in the context of different cultural norms.